Thank you, Crystal. So at this time, I'm going to introduce Dr. Anjali, and she was trained in the UK. She's been practicing in the realm of infertility, IVF, ICSI, and surrogacy for 15 years, and has been doing international surrogacy throughout. She specializes with egg donation with surrogacy.
I'm going to talk on IVF and surrogacy for an Indian scenario. I'll keep it as quick, simple, and straight. You are all tired listening to all the lectures already. Although IVF is a vast topic, it's difficult to touch all aspects of IVF. So I like to focus mainly on surrogacy, egg donation, and important is for embryos and gametes, because these are the main topics of interest for intended parents coming from abroad. Now, for last few years, India has been one of the favored nations for foreign nationals, mainly for surrogacy treatment. Now, why they should select India as an option? First important reason is good medical care. The quality of medical care that you get in India is a world class. There is no dearth of medical expertise as well as technical expertise, and the equipment is a world class. The success rate in India are at par with majority of the good clinics in the West. So that is the most important reason. And this all is offered at a distinct cost advantage. You must be knowing that the cost of surrogacy treatment in the countries like US is phenomenal, and many of the couples who are staying in US may not afford that treatment in US. We have seen that in the last few sessions. And in India, the same quality of treatment can be offered at significantly lesser cost. Third point is a favorable legal atmosphere. As you know that surrogacy is not recognized and legal in many of the countries across the world. And India is one of few countries where surrogacy is recognized and legal. Is also allowed to compensate the surrogate mother. And last but not the least is the connectivity. As you know, India is a vibrant economy and is well connected to the rest of the world through mobiles and internet. So it becomes very easy to communicate with the intending parents throughout the procedure, before, during, and till the delivery of the surrogate through the mail. And this is very important. Now coming to the surrogacy laws in India, I'll mainly focus on the legality of these matters, because that is the most important point on the of intended parents. At present, there is no law as such pertaining specifically to surrogacy. Having said that, there is an ART bill which is in the draft stage now. The ART bill draft was made in 2010 and it is being modified since then. So currently we have to rely on existing acts, the guidelines issued by ICMR, and the notifications issued by Ministry of Home Affairs and External Affairs from time to time. Currently, the disputes arising out of surrogacy arrangements are decided in the court on the basis of two acts, that is Indian Contract Act and Indian Evidence Act. So the agreement between the surrogate and intended parent is the most vital document which decides any disputes. Indian Council of Medical Research is a regulatory authority in India which controls the ART practice in India, and it has issued guidelines in 2005 regulating the ART practice in India. And these guidelines form the basis of various provisions in the ART bill which was drafted in 2010. Now, for the ease of discussion, I'll divide these guidelines into three. There are guidelines for intended parents, there are guidelines for ART clinic, and there are guidelines for surrogate mother. Now, the ICMR guidelines, I would rather say these are the notifications by Ministry of Home Affairs regarding who can opt for surrogacy treatment in India. MHA has issued notifications that only heterosexual couple who are married for 2 years can opt for surrogacy in India. At present, Government of India does not recognize gay marriages. The single man or woman at present is not allowed visa for fertility treatment. Let me make myself clear on this point. As per ART bill, or ICMR guidelines, everybody has a right to earn. Married couples, unmarried couples, that means those who are in living relationships, single individuals, all are allowed to have any form of treatment, including ART as well as surrogacy. But because of the visa restrictions, the foreign nationals who are single parents cannot come to India for surrogacy. So that means that if an Indian national is staying abroad with an Indian passport, he can come for the same treatment. But at the same time, if Indian national who is having foreign passport, although he is having PR card or OCI card, cannot will be treated as a foreign national. He will not be allowed to have the surrogacy treatment. And the type of visa should be applied for is a medical visa. Previously, people used to come on tourist visa, which is no more allowed. Now, there are certain requirements for the parents to fulfill before they get a medical visa. First is a letter from the foreign ministry of the country of the intended parents or the embassy in India. And the letter should clearly state that the country recognizes surrogacy and the child born through the surrogacy arrangement will get entry into their country as their own biological child. That means the child will have all rights as if it was born to the natural birth. Second is the undertaking has to be provided from the intended couple that they would take care of the child through surrogacy. The treatment has to be done at one of the ART clinics which are recognized by ICMR. Recently, I mentioned that ICMR has made a national registry of ART clinics in India, and it has issued certificates to those clinics which are enrolled in national registry. The clinics have unique ID number, and good that intended parents inquire about this and get a scanned copy of certificate just to check that the clinic they are taking treatment at is enrolled with ICMR. And the final and most important thing is notarized agreement between the couple and surrogate must be made before taking a medical visa. So these are the 4 most important requirements for getting surrogacy visa. Then we come to the ICMR guidelines or the ART with provisions about the surrogate mother. It is necessary that the woman is young in the reproductive age group between the age 21 and 35. Nobody is allowed to have any ART before the age of 21, whether it is a donor, whether it is surrogate, or whether it is patient with the own gametes. The upper age limit is set to avoid the complications of pregnancy. It is clearly understood that surrogate is not a legal mother. She has to relinquish all the rights of the child in the agreement itself. Also, it is very clear from the beginning that there is no genetic link between the surrogate and the child, which means that traditional surrogacy, where the surrogate used to be inseminated with the intended father's semen, is no more possible in India. Only gestational surrogacy is allowed now in India. And other important criteria is she should be physically and psychologically fit to go through a successful full-term pregnancy. Then there are certain mandatory medical tests, like an infection screen for HIV, hepatitis B, hepatitis C, rubella screen, and as Dr. Neeraj had said, she has to be screened for various medical disorders like diabetes and hypertension, which can influence the well-being of the fetus. Then she has to provide a written certificate that she had not taken IV drug through the shear syringe, there was no blood transfusion in the past 6 months, and she had no extramarital relations in the last 6 months. So enough care is taken to ensure that she has not incurred any infections during the months. No, as per law or as per ART draft, no woman can act as a surrogate for more than 3 times in a lifetime or give birth to maximum of 5 children, including her own. That means if she already had 3 children, she can't do surrogacy more than twice. The maximum number of children allowed either her own or the surrogacy is 5. Then there are guidelines for the clinic. While enrolling into the National Registry of Clinics, the ICMR confirms that clinic has basic infrastructure of providing the ART services, and such clinics are enrolled in the National Registry, and this has to be confirmed by the foreign couple. Now, putting all this legality together, how we can do the process of surrogacy in an individual couple, how we can apply these things to an individual couple. The process starts from inquiry from the intending parent and ends with any exit visa. There are multiple steps in between. First is inquiry, confirming that the clinic is registered in the national registry, and once they confirm that they are doing treatment after we get counseling with the clinician, then comes the process of surrogate plus minus donor selection at the case meeting. Then surrogate and if third donor is involved, both are approved by the intended couple after providing all the necessary medical reports. After this, the agreement has to be done between the intended couple and the surrogate, and now they get the ready for medical visa application. I would advise for couples coming from abroad to have some legal advice in their own country as well. That will make a life easy for them getting a medical visa. After they get the medical visa, then comes the step of donor and surrogate preparation for ART cycle. While doing this, intended parents fly to India. After flying to India, they have to be registered with FRRO, that is Foreign Residence Registration Office. This step is made mandatory recently. It was not needed before, but now it is necessary that all couples coming to India for surrogacy have to register prior to embryo transfer with FRRO. After they register with FRRO, then the treatment is done either through IVF or ICSI, and embryo transfer is done in the surrogate. After embryo transfer, the IVs fly back to their home country. After some time, on the scheduled time, the pregnancy test is done, it is found. Oh, short time, got to finish. Okay, I'll finish it quickly. IVs fly back. Then, if the surrogate is found to be pregnant, she enters into the routine antenatal protocol. After she has a delivery, IVs fly back to India to collect all the necessary documents like birth certificate, passport, FRRO clearance, and then get exit visa and fly back to their country. This I'll just move quick because we have discussed about surrogate selection, what they do the ID check, address check. Then in case of a married woman, it is mandatory to obtain the consent of husband. In case of a widow, it is necessary to get the death certificate of the husband. If the woman is divorcee, it is necessary to get the proper decree issued by the court. If the surrogate is not legally divorced but separated, then affidavit is made by the surrogate that she is separated from the husband for so and so long. Then come the necessary blood test, which I already discussed, the infection screen and the medical fitness is taken. ECG and 2D report if advised by physician. The surrogate is thoroughly examined and certified by physician as well as by a psychologist. Then her ability to take the pregnancy to term, that is pelvic examination is done by detailed pelvic ultrasound, 3D ultrasound and hysteroscopy is done in selected cases, endometrial thickness evaluation at ovulation is done, and uterine artery Doppler study and endometrial Doppler study are also done. Then we come to the stage of agreement. I have already mentioned that there is no need now to apply just for making an agreement. If the couple wants, the agreements can be done online as I discussed before, but it is a prerequisite for getting medical visa. Now after making the agreement, the embryos are made using IVF and ICSI, either using patient's own gametes, couple's own gametes, or sometimes using donor gametes. Now once the surrogate is found to be pregnant, she enters the routine protocol of antenatal care. She gets proper nutritional support, the psychological support. Has been mentioned the two choices they are given previously, like staying in the surrogate home or at domiciliary care, and as the case may be, they are offered these choices. The decision and the time of delivery is as per obstetric indication, but still I would say, as Jayesh pointed out, that cesarean section, elective cesarean section is still done at many places. Now after birth, there are certain formalities to be completed, like getting a birth certificate. In India, ART is quite favorable to the intended couple, that it is issued in the name of intended parents. There is nowhere the mention of donor or the surrogate in that form. So that is a very favorable point for intended parents. Then comes the stage of getting passport, followed by FRRO approval, and then comes the exit visa. Now, for getting a passport, it's usually necessary to do a DNA check and establish a genetic linkage between at least one of the partners and the child. But just now I learned in the previous lecture that now US has removed this sort of, it's not mandatory for US citizens, it seems, to do this DNA check, but for many countries it is necessary. Now, after getting the baby's passport, patients have to get the FRRO approval before getting exit from the country, and FRRO obtains a certificate from the ART clinic, and the certificate has to state that the child or children born out of surrogacy are taken into the custody of the intended couple and liabilities towards the surrogate have been fully discharged. So, FRRO will retain the copy of birth certificate or certificates of the children as well as the photocopies and the passports of the couple. Passport plus FRRO clearance is equal to exit visa, and then we can fly. Coming to the egg donation, I'll finish quickly. Use of egg donors is allowed as per ICMR guidelines, but donation has to be anonymous, although non-identifying information can be provided to the intended parents. It is allowed for the donors to be compensated. Apart from medical fitness, the patients coming from abroad will be foreign nationals will be interested in knowing ethnicity and educational background. And India itself being a multi-ethnic and multi-racial society, over the thousands of years, it is possible to provide the donors of various ethnic origins even in India, and also the educational background to some extent within limitations can be provided. About flying donors, this is a bit grey area. Previously the donors used to fly in India, but there is no clear guidelines regarding the flying donors in the ART bill as well as ICMR guidelines. But as per the discussion with the legal experts in India, I think they have to now get medical visa. Previously they used to fly on business visa, but now they have to get the medical visa, and they will need the supporting documents for this. Donors in India get the similar evaluation like surrogate, like document checks such as ID proof and address proof are done, blood group matching is compulsory, mandatory, the blood tests are done to check for the medical fitness, and they are screened for common genetic disorders like thalassemia. The donor gets controlled ovarian hyperstimulation followed by egg retrieval. At that stage, the role of donor is completed. Coming to the last topic of import and export of gametes and embryos. Now there are clear guidelines issued by Ministry of Health Affairs and the abbreviated unit. These are various sites on which you can get the guidelines which are given by MHA. The gist of the guidelines is that embryos or gametes should not be used for treatment, should be used for the treatment of individual couple and not for any other purpose. And the couple has to satisfy all the criteria. That is for getting medical visa. That means it has to be a heterosexual couple married for at least 2 years. According to Indian PCPNDT Act, no sex selection is allowed before placing the embryos in the survey, and it is not allowed by the MHA to use the embryos for research or any other purpose. And for getting import and export license, the license is issued only on case-to-case basis, and there are certain documents are required by MHA to issue this license. So these are the IP license, the import-export license requirement. That is necessary to have a certificate from the ART clinic abroad, as well as necessary to have the certificate from the ART clinic in India, which has to be ICMR enrolled. It's necessary to have a certificate from infertile couple from the foreign country that they are going to use embryo for their own treatment, and the agreement of surrogacy whenever it is applicable. So these are the criteria for getting the license. So we have to obtain the permission face-to-face basis, on face-to-face basis. So in conclusion, I would like to say that international surrogacy is a complex situation because it involves different individuals from different countries having different cultural backgrounds who are involved in the reproductive process. We all know that surrogacy is recognized and legal in very few countries. Even in countries like US, the laws differ from state to state. In many countries, it is still illegal to have surrogacy, either adjudicative or compulsory surrogacy. So So India has got a unique advantage in that it provides the world-class treatment at an affordable cost and to be favorable legal atmosphere. Thank you.
Look, I must say, having worked in this area for years now, and worked with many people around the world who've used clinics in India, if you're eligible for India, it's a much better option than Mexico right now. So if you're lucky enough to be married for 2 years plus, then, and you're considering India or Mexico, then to me it's a no-brainer. You want to be in India because they've been doing it for years, the process is done well. We've got some of the best doctors in IVF who are here this weekend who do good work. My one recommendation would be one embryo transfer at a time. Otherwise you'll be fine. Good to see you all. Come and have a drink outside.